Restless leg syndrome is really common during pregnancy. And for many pregnant women, it can be more than just a nuisance to add on top of the discomfort and other difficulties with sleeping. But how is restless legs best treated when someone is pregnant? I'm Dr. Andy Burkowski of ReLACS Health, and we're going to talk about treatments for pregnancy today. 1 in 5 women statistically will develop restless leg syndrome during pregnancy. Fortunately, in 70% of cases, it seems to resolve after the baby is delivered. But for many women, this can be one more difficult symptom to deal with during this pregnancy. It tends to increase in the 7th and 8th months of pregnancy and then kind of get a little bit better toward the end as we get toward delivery. What are the causes of this high rate of restless leg syndrome? Well, it's sort of like the baby is stealing all of your iron. Low iron levels in the brain are the main cause of restless leg syndrome as far as research can tell. And with the growing baby inside the mother, lots of iron is being used up to help with that growth, building blood cells, growing the child. And this can cause a state of flux in iron. That's probably the best theory we have. Certainly, there could be other causes that relate to estrogen and different changes and hormonal disruption. And certainly, the disturbed sleep that one may experience while pregnant also contribute to waking up a lot during the night and experiencing restless leg syndrome. In 2015, the International RLS Study Group put together a consensus paper where the experts got together and gave their opinion on what the best treatments are. And by far, medications are not the best approach to dealing with restless leg syndrome during pregnancy. The key is really to prevent it by avoiding triggers. So your typical triggers are going to be caffeine, nicotine, and of course, never want to be drinking alcohol during pregnancy, but those tend to be substances that one might ingest that can trigger the condition. Another sneaky one are the older generation antihistamines, your Benadryls, all of those PM medications. Those have antihistamine properties that enter into the brain, and those can really trigger restless leg syndrome when trying to sleep. And then another one are some of the anti-nausea medications like Compazine can be a trigger for restless legs. Maybe Zofran tends to be better, but you combine some morning sickness with an anti-nausea medication, you could trigger restless leg syndrome. So careful avoiding that. It seems like moderate exercise tends to be very helpful in cases of pregnancy, so that's recommended. Of course, to the degree that's recommended by one's obstetrician and limited by that, definitely. And then other forms of activity, particularly in the evening, whether it's massages, stretching, or even yoga, things to get the legs moving and to relieve the symptoms. One of the important ones is to watch out for obstructive sleep apnea. This is a condition where the throat can collapse and cut off breathing during the night. This is a big trigger of restless leg syndrome, and obstructive sleep apnea can come on during pregnancy, particularly in the third trimester, and be a huge risk for preeclampsia and other complications. So it's important that if an individual is snoring loudly and stops breathing, that they get checked out by their physician and potentially tested for sleep apnea. So once all of these, what we call behavioral or preventative measures, are taken care of, the main thing is to assess for iron levels. Iron, iron, iron. Check iron levels, supplement with iron levels. This is the best way to approach restless leg syndrome in pregnancy. Pregnant women who are experiencing significant restless leg symptoms should be doing a regular morning fasting, ferritin, and iron TIBC. It's a combination that results in the transferrin saturation. So if the ferritin level is below 75, or the transferrin saturation percentage is below 20%, iron supplementation is going to be extremely important to help with the condition. For iron supplementation, generally if it's not too low, but it's still below a ferritin of 75, anywhere from 25 milligrams of iron up to 65 milligrams of iron, preferably every other night, may be effective in bringing up those iron levels. Of course, as I've talked about elsewhere, iron supplements can cause a variety of discomforts, which need to be watched out for. Now, if the ferritin level is really low, like really iron deficient, such as a ferritin of below 30 to 40, a person's not going to have time to absorb those iron supplements to bring those iron levels up. By the time the baby's delivered, the iron levels will still be low. So that's when you would move to an IV iron infusion. Or if symptoms are really severe and the ferritin is less than 75, IV iron infusion would be recommended. There are many formulations of IV iron, and many of them have been tested in pregnancy and are quite safe. This will bring the levels of iron up almost immediately, and then over the course of a few weeks, it'll penetrate into the brain and relieve restless legs syndrome. In the rare cases that iron either can't be used or is ineffective and it's fairly moderate to severe symptoms, then medications could be considered, but a lot of these options are not good. Our first-line medications like gabapentin and pregabalin or Lyrica are we're not really that sure whether it's safe in pregnancy at this point. It doesn't mean they can't be used, but there's just not a lot of certainty. One of the drugs that is fairly safe during pregnancy is levodopa, or goes by the brand name Sinemet. It's a Parkinson's drug. The problem with levodopa is with a few months of use, one can develop augmentation from this, which I've spoken about elsewhere, but that could be a consideration. And then also low-dose opioids could be used, such as oxycodone. But again, whether it's an alpha-2 delta drug, levodopa, or opioids, medication treatment should really be a last resort. And pregnant women with significant restless leg syndrome really should be focusing on evaluating iron levels and doing a lot of preventative measures to prevent restless leg syndrome during pregnancy. As always, these videos are for general informational purposes only and do not constitute the practice of medicine. Pregnant women who are concerned about their restless legs syndrome should be making medical decisions with their obstetrician or sleep physician, and not by anything I said in this video. And as always, one of the keys to sleeping well is to relax.